The one thing I want you to remember when it comes to caring for your child's uncircumcised penis is to keep it simple. When it comes to circumcised penises, a lot of people already know what to do. When it comes to uncircumcised penises, caregivers, even providers get a little bit confused or get tricky regarding when to pull back, when to retract, or to leave it alone. When the penis is uncircumcised, the foreskin is still tightly attached to the head of the penis, and that's just about like your nail being attached to your fingers. So trying to pull off the skin or the foreskin or pull back to clean can cause bleeding, can cause pain, but can also cause scarring if that's done repeatedly, which can cause complications in the future. It can also result in an emergency called paraphimosis, where parents are able to pull back the foreskin to clean, but the foreskin is not able to return to its original position, and it can cause swelling and redness, and this is an emergency. So within the first couple of years of a baby and your child's life, all you want to do is clean what you see. Clean it like the rest of the body with mouth soap and water. You don't need to pull back. You don't need to use Q-tips to go into the crevices to clean anything, because by doing that, you may be predisposing them to pain and bleeding. So cleaning like the rest of the body and nothing special. As they get older, the foreskin starts to separate on its own from the head of the penis. This can happen as early as 1 year of age, 2 years of age, some 5, but some may not completely separate till about puberty. When the foreskin starts to separate on its own, you may start noticing a white cheesy material around that area, which we call smegma. Smegma is normal and it's not an infection. So smegma is a mix of dead cells and skin cells and also fatty oils from the separation that starts to happen. So that mix causes that white substance you start to see, and that usually needs to be cleaned off gently. While smegma is normal, excessive amount of accumulation of smegma around that area can start to cause irritation and sometimes predispose the child to infection. So you can gently clean it off every time you see it, but it's not something I want you to be concerned about. That will need antibiotics. When the foreskin is now separated from the head of the penis, so it's separating, you can gently pull back and wash with water, or you can start teaching your child as they grow how to retract and wash with water. You may or may not need soap. It's more like a mucous membrane area like the vulva, so you can use mouth soap if you want to, but you can definitely start to retract gently and wash. So in summary, within the first few years before the foreskin separates on its own, don't pull back, don't use Q-tips, clean what you see. When it starts to retract on its own, then you can gently pull back and wash with mouth soap and water. So a lot of education and awareness still need to go into the care of uncircumcised penis. So don't forget to let your caregivers and your providers know that you don't want your child's foreskin to be pulled back, especially when they're babies, because it's still tightly adhered to the head of the penis. Let me know in the comments what your experiences have been about caring for your child's uncircumcised or circumcised penis, and I will see you in the next video.